Hello again, this is Alex Beyer, and just want to talk a little bit about some specialty trusts that are used when we're doing long-term care planning, and why we're creating them and what the benefit is. So when we're doing long-term care planning and we're trying to gift assets, and we talked about that in another video, but when we're trying to gift and we're trying to transfer some assets the way that Medi-Cal allows and the law allows us to do, we don't want to just give away all of our stuff, give away all of our assets, and then we have no control. And we don't know what's going to happen if we need those assets at some point in the future. How do we pay for some of the other care that we need if we're only getting somewhere around $35 out of what's left on our Social Security or something like that? So what happens is we usually create. It's usually going to involve creating a specialty type of special needs trust called a third-party special needs trust. And what the third-party special needs trust is, it's a trust that's not created by you or the person that's going into the care facility. It's going to be created by somebody else on their behalf. So they're going to create a trust that is solely for the benefit of the person that's going and getting the Medi-Cal assistance, that they're going to go into the care home. So somebody else is creating that. It's not going to be us. And the sole purpose, again, is for the benefit of the person going into the care home. And then after some time, when somebody passes away, then it's going to go to whoever was designated in that trust, whoever it's supposed to go to in the first place. So what happens is, after the gifting is done, then generally somebody else who loves us and has those has our assets, they're going to gift them to this trust that's made for our benefit or the benefit of the person in the care home, so that it can take care of things that need to be taken care of on their behalf, and so that they have the amounts to do that, and without having to spend everything down and becoming poor in order to get Medi-Cal assistance. And another type of trust, so sometimes one of the assets that you have when you're qualifying is your home. And if you have it specifically in your applications, if you have it in there correctly, then your home is an exempt asset. So it's not going to count towards your asset qualification for Medi-Cal. However, sometimes there's a necessity. Maybe there was insufficient other funds from somewhere else to pay for something, or the house needs to be sold, and originally you're planning on going back and living there again if you're able to get out and not have to be in the care home anymore. But if that didn't happen and the house needed to be sold, as soon as you sell the house, the problem is now you have a whole bunch of available funds. Now you have these available funds, and you're at risk of losing the Medi-Cal benefits that you have. So what we do is we are able to transfer this exempt asset into what we call an IDGIT. It's an intentionally defective grantor trust. And what the IDGIT does is, for certain purposes, for tax purposes, it's not considered a complete gift, and for other entity services, it's considered a gift, and it's no longer going to be in your estate. Since it's an exempt asset, you can give it away in that way. So once it's transferred into the IDGIT, the house can be sold, and the proceeds will not affect the Medi-Cal benefits. And once the proceeds are in there, then they can also go towards the institutionalized person's benefit, and it can help them until they pass, and then the proceeds can be transferred wherever they need to be transferred at the time.